I, on behalf of WorldFish, wish to welcome you to this fish talk today on World Nutrition Day with focus on COVID-19 and nutrition. World Nutrition Day, also known as World Hunger Day, is a worldwide initiative to fight hunger and malnutrition. In these times, with the COVID-19 pandemic, combating hunger and malnutrition takes central stage, with the health crisis quickly shifting to also include a food and nutrition crisis in many countries, and especially for the poor and vulnerable. We have invited four presenters to give us some insights from a global, regional, and national perspective. Please join me in welcoming our presenters, Kendra Byrd, Pamela Marinda, Shaima Shaheen, and Marian Kelleval. Please begin to enter your questions and comments in the chat box. Doina and I will select some to be answered or commented upon by our presenters in the Q&A session, which follows the short presentations. Thank you. So now we begin with Kendra.
Good afternoon, everyone. Thank you for joining us today. I am going to give a perspective from the global side of things, and my colleagues will dive in a little bit to the country level responses to the COVID-19 pandemic. So to start, unfortunately, prior to the COVID-19 pandemic, the number of hungry people on the planet was increasing. I'd like to highlight this report from the FAO, the State of the Food and Nutrition Security in the World in 2019. And they found that 820 million people were hungry in 2018, and that is more than the population of Southeast Asia. And hungry in this case means a lack of access to food. So hunger is represented by undernourishment. So these people simply do not have enough calories. And this does not include the other forms of hunger, such as hidden hunger, which is micronutrient deficiencies. So this is the tip of the iceberg. When we take into account a more broad definition of hunger, such as food insecurity, that number jumps to 2 billion people. So 2 billion people do not have access to sufficient, nutritious, and safe foods prior to the COVID-19 pandemic. And 92% of those people were in low and middle income countries. Of course, not forgetting that the 8% in high income countries. And I just wanted to highlight here that the report that was done in 2019, the byline was safeguarding against economic slowdowns and downturns. So the global nutrition community was very much concerned with the way that an economic downturn would impact food and nutrition security around the world. And of course, now we are facing an economic downturn of an unprecedented scale. So next slide, Doina, please. And so, of course, the predictions for food and nutrition security as a result of the COVID-19 pandemic are dire. And there's a number of predictions out there, but I would just like to highlight two here. One by the World Bank that was done earlier this month. They estimate that an additional 130 million people could face acute hunger by the end of 2020. And again, this is just the tip of the iceberg. This is a lack of calories. So this does not account for the people who will be micronutrient deficient as a result of this global pandemic. And those micronutrient deficiencies, if they are within the first 1,000 days, so pregnancy and under 2, have intergenerational effects. So it's important to act now. In addition, more people will fall into poverty depending on how much the economy contracts, which is very much under debate right now. So I just wanted to highlight one report from the UN University where they modeled different rates of economic contraction. And under a worst case scenario, they found that global poverty could increase for the first time since 1990. And of course, these people will also be hungry, and some will also be micronutrient deficient. So there is a call for urgent global action on the part of many governments and organizations, of course. And I just wanted to highlight a few here that are more relevant to WorldFish. And the first is keeping smallholders in business. And of course, by keeping smallholders in business, this will keep supply chains or value chains working. which is the second bullet, and the third bullet, which is to shore up incomes and stimulate food demand, which are important drivers of food systems. So many are also already doing their part to keep smallholders in business. The Global Alliance for Improved Nutrition, also known as GAIN, has an emergency fund called Keeping Food Markets Working to help smallholders. The government of Bangladesh, which Shaima will talk more about on the call, we'll hear more about Bangladesh from Shaima, has announced a bailout package for small and medium enterprises, including fish farmers and seafood farmers in Bangladesh, which are like seafood workers around the world being hit hard by the COVID pandemic. And the FAO has also put together some documents highlighting the response, highlighting what was done with the Ebola outbreak in the downturn of 2007 and 2008 to inform policymakers on how to help protect smallholder farmers. And another report by the FAO states that all economic stimulus packages must also, among other things, be focused on keeping food supply chains functioning, so value chains functioning, while promoting access to food. And so how can we turn this not into access to food, but access to healthy food? So that economic stimulus packages and food packages can go hand in hand in increasing the health of the population. As we know, as incomes rise, dietary quality does not always increase. We found this in a survey of households in Zambia. So how can we stimulate the production of nutrient-rich foods, which is going to be very important in response to the COVID-19 pandemic. So by maintaining the supply of nutrient-rich foods, of which fish and other aquatic foods is a key food group, not only do we address hunger and the hidden hunger of micronutrient deficiencies, but nutrient-rich foods are of course important for immunity. So when an individual is faced with an infection such as COVID-19, the energy requirement goes up. So they need more food in general, just more calories. But they also need more micronutrients such as zinc and vitamin A, two nutrients that are commonly found in fish and seafood, zinc being highly absorbable in seafood. So by keeping smallholders in business and keeping supply chains working, which shores up incomes and stimulates food demand, and we hope to make that demand for healthy food. These things are an important part of the COVID-19 response globally, and WorldFish has a big role to play in addressing the food and nutrition security crisis that we're facing. So thank you very much, and I'll turn it over to our next speaker.
So thank you everyone to give me opportunity to talk in front of you. So my topic is COVID-19 impact in Bangladesh and its impact in nutrition and in its responses. So in Bangladesh, here over 19% people are from workers are from informal sectors, and only 15% can earn more than $6 a day. So most the family's ability to eat depends on their day. According to a joint survey conducted by two local research organizations, that the Power and Participation Research Center and BRAC, we came to know that since the outbreak of coronavirus, the average income in the slum area and among rural people dropped down by more than 18%. And according to another survey that was also published in April, that was actually a government report that multisectorial impact and its multisector anticipatory impact and need analysis report. We can see 75% respondent mentioned they don't have sufficient access to food. 20% indicated that they are not providing diverse diet to their children, that is under 2 children. And the price of rice and rice of potato also increased, and price of rice increased around 13%, price of potato increased around 25%. So you can see the first picture in here that people block the highway on demand of food during this lockdown. So this is the overall scenario of Bangladesh. So the government and other organizations that private sectors are taking some initiatives to help the poor and actually distressed people. Plan that they are plan to support more than 10 million people through food supply, through ration card, and for emergency food supply, 5 billion people will get free food assistance during this situation. In second picture, you can see that the local government peoples are distributing this food. They are making this list and they are distributing these fruits, and they are providing 7 days ration. That is the dry foods. In these rations, they are included that potato, rice, lentil, oil, sugar, salt, in some cases soap, and some areas they are also providing mango, and they included fish, dates, these types of things, semolina. So to support children in the household level, they are actually providing this semolina and sugar. So these are the good initiatives, but compared to our total population, because we have 161 million people, so this is not enough. So government have another plan, that is ration card. So 5 million, currently 5 million people is getting this facility. So the through this facility, that government is providing rice. The families can buy rice, that is for per kg 10 taka. That is around 12 cents if we convert it in dollar. And each family can buy 5 kgs of rice at a time, and for a month they can buy 20 kgs of rice. So recently government decided to include 5 million more people in this category to minimize the actually hardship of COVID-19 during this during this season. And that was another initiative, and this group will be actually the lower economic group, that rickshaw pullers and small industry actually workers, these types of people of the third generation, these types of people. And another initiative is that government, in collaboration with other partners, that FAO, WHO, they develop some guidelines to prevent COVID-19. So they are actually so other organizations and government peoples, they are using these guidelines so to help people, because COVID-19 is new in here, we don't know what to do. So what government instructions are giving us, we are following the instructions. So in case of Bangladesh, the role of NGO sector and private sector is very huge. We have more than 2,500 registered NGOs in here, and from WorldFish also. WorldFish, we have so local TV channels, national TV channels. They can the mothers on our community can get any the such of benefits, and not only that, we have some farmers groups, so we are directly sending messages to them, so how to take care of their children, their pregnant women, their adults, so they are getting this sorts of facility from us. So the NGO sectors, not only this awareness building, some are also delivering foods at the community level. They are also aligning with government. They are also giving 7.5 kgs of rice, semolina, sugar, salt, soap, these types of foods, dry foods items to the community. And here you can see a poster that these were actually developed by Bangladesh Institute of Public Health, and here they talk how to prevent coronavirus with nutrition. So they told about the importance of diversified diet, importance of vitamin C, importance of fish. So we have fish in everywhere, but the main thing that we don't have such by diverse diet to feed our. This is actually our current scenario. Thank you, everyone.
And now we will move to Marian Kellevold from Norway.
So overall, the COVID-19 situation has not had major negative impact on the nutritional situation in Norway. However, several interventions from the government has ensured availability, access, and stability to food through this crisis. As you can see on the figure, Norway is one of the countries with lowest self-sufficiency ratio, and thus depend on import of food to cover the energy requirements for the population. Self-sufficiency can be defined in many ways, but if we take the FAO definition, it is quite broad defined as the extent which a country can satisfy its food needs from its own domestic production. So the self-sufficient rate for agricultural products in Norway varies from year to year, dependent on the weather. Overall, Norway has less fortunate conditions for agriculture than many other countries, with short growing season, a cool climate, and farmland scattered in small patches. Despite these challenging conditions, Norway has seen an increase production in recent decades. Norway is largely self-sufficient when it comes to meat, and increasingly less so with regard to plant products, including fruits and berries. And Norway is a net exporter of seafood. In other words, we produce everything we need domestically, and we also export seafood. In March, we experienced the most dramatic interventions from the government in peacetime, including the lockdown on kindergartens and school. In Norway, we don't have any school feeding programs. So the children, they get their lunch prepared from home. In many schools, you don't have facilities for cooling, so this is mainly bread with bread spread. In some schools and kindergartens, you have access to milk products and also sometimes to fruits. So this means when we had this lockdown and people had to stay home, it was not a very big difference for the children when it was even maybe better access to high quality food, because you had a fridge home and you had parents home having time to prepare meals because they were not going to work. So it has had maybe the opposite result in Norway. Collaboration between the food industry and health authorities has ensured that food has been available throughout the lockdown period. These also include the seafood industry, which has been classified as critical function for the society. Welfare systems have ensured that all citizens have had income, also those that lost their job during the lockdown or due to the lockdown. And because of this welfare system, everybody has had money to buy food. These photos are from the first week of the lockdown, the two first photos, and you can see people crowded in the shops and afraid of that it would be empty, and also people stock up on food, resulting in that some foods very temporarily were sold out. But then the health authorities went out with information and asked people to not stock up on food. The Norwegian seafood industry, which is the second largest seafood exporter in the world, has been fully operating through the lockdown. However, for the first time since September 2018, Norway has experienced a fall in the value of its seafood export. In retail, there is increased demand for convenience products and prepared seafood, as well as those with longer use-by dates, such as frozen, dried, salted seafood products. So there have been a change from fresh fish to processed fish. One of the major shifts experienced in the growth of retail is the growth in retail and online shopping, as people increasingly stay at home and are cooking meals together, also including the children in the meal preparation, and have better time to eat the meals together with the family. The lockdown has resulted in higher focus on eating healthy, also among those with lower income. The seafood intake has increased, more people buy from local producers and are concerned about where the food comes from. And the most significant change in attitude is that far more people than before, 70%, believe it's important to support Norwegian agriculture and food production, and that self-sufficiency is important. In addition, 1 in 4 state that they have reduced food waste. So in conclusion, the lockdown has changed people's attitude to food, and future will show if this positive effect will be lasting after the crisis. Thank you.
And we are still having some issues getting Pamela on from Zambia. So Donia and I have agreed that we will put her slides on, and I will talk to her slides as best as I can in her absence. So in general, if you would look at the African diets, especially of the poor and vulnerable before COVID-19, it is dominated by high poverty, with population groups having high poverty rates, and diets dominated by staples, for example, maize. And there has been some food given to children, underprivileged children, through school feeding programs, 1 meal per day. In some In some countries, in some areas, that's a warm meal. In other areas, that's a snack. Now, with the COVID-19 situation, where the schools are closed, children are not receiving this meal at school. During the COVID-19, and that's now, what has happened, and very quickly, is that food supply chains has been interrupted due to the lockdown and due to the transportation. And just as Shaima told us about the condition in Bangladesh, where lots of people are not being able to eat sufficient food or to get nutritious foods, and that is because they depend on their daily wages in order to buy food. And with the loss of daily wages, with the loss of income, that has a direct effect on the quantity and the quality of foods that people can buy. Also, very quickly, increases in food prices have been seen in African countries, both for the staple foods and for all other foods. And there is, because of the lack of transportation, the lack of lockdown, because of lockdown and poorer movements of people, greater losses in foods are being noticed, both at the producer level and at the trader level. Some discussions and surveys have been done during the COVID-19, and a very pronounced narrative is that people talking about the hunger that now happens in the lockdown period. And a very telling quotation is, instead of the coronavirus, the hunger will kill us. There is further marginalization of the poor, and their food and nutrition insecurity situation is worsening. And it's also for subgroups of population with special needs, we are seeing that their dietary requirements are being compromised. From preliminary findings of a survey which was done in May 2020, what has been noticed is that there is a reduced consumption of nutritious foods, such as animal source foods, fruit, and dairy products. And this, many people have said, is due to the increase in prices, the lack of access, and thereby not being able to afford and to buy these foods. Second slide, please. Pamela has given us some of the responses to COVID-19, and she has looked at the she has looked at the three areas: food availability, food access, and food utilization. And the three countries that she has looked at is Zambia, where Pamela is based at the university, Kenya, where Pamela stems from, and South Africa, which normally lots of countries in Africa would compare themselves to in times of crisis, because there's this narrative that South Africa in many situations can react faster and can put measures in place better than other countries. And if we look at what are the interventions and responses that have been put in place, you can see that there are actions for food transportation to happen within and across borders, that supermarkets should stay open, and food markets also should stay open. The open markets should continue. In the case of Zambia, there are no economic relief and tax relief measures which are put in place, and that has happened in Kenya and happened in South Africa. Food rations, food donations have happened in all three countries. Employment measurements by the governments, for example, food for work programs, things like that, have been put in place in all countries, and food prices are being monitored. With respect to utilization, there are different programs that have been strengthened. For example, nutrition guidelines with respect to income and young child feeding practices, nutrition with respect to non-communicable diseases, where special attention is being paid to the changes that are happening under COVID. For example, the less consumption of nutritious and diverse foods. So more attention is being placed on these in the guidelines and the messages. And many of the institutions, both government, non-governmental, and the private sectors, have vamped up their messaging with respect to nutrition, but also with respect to increased sanitation, washing hands, using soap, and provision of food in special circumstances. Thank you.
Let's continue with asking some of the participants here a few questions on their presentation first, and after that we will take some more questions from the team.
I can ask a question to Shaima. Shaima, we heard from Marion. Well, as you know, Norway is a fish producing country, and fish export and fish consumption is a big part of the culture in Norway. It is also so in Bangladesh. So what specific have there been any specific actions for using fish as part of the COVID-19 responses? As we heard from Kendra, that fish can be a particularly good nutritious food for having in diets, also to boost the immune system. Shaima?
Yes, Shakuntala. So yeah, as you mentioned, it's Bangladesh is like Norway, that we have a sufficient amount of fish, and we are exporting a huge amount of them. But yeah, recently the government Ministry of Fisheries and Livelihood Ministry actually instructed the district level and sub-district level government officials to actually include fish in their relief item. In some area, very few. In some area, they are also they are started to distribute fish in relief item. But you know that it is very difficult because it is perishable. It is difficult to manage compared to the dry food. So it is not in huge amount, but in some areas they start this initiative, and it is actually a good initiative. And you know that we have lockdown is going on from 26th March, and still it is continuing. And so from government instruction is that fish trucks is out of this lockdown, so they can move. But still, yeah, we are suffering a huge, because most of the fish are used to come in Dhaka. There is the most dense population and people have money to buy fish. But during this COVID-19 situation, it's actually totally hampering. Our fish farmers are really hampering. If we consider one district, that is Rajshahi district, usually in average they used to send 200, one district, they used to send 200 trucks of fish in Dhaka. But now it is dropped down to 20 trucks a day. So you can see the impact. But the good thing is government thinking this issue, they are actually trying to take some initiatives to actually help this sector. Thank you.
Now, Kendra, Doina has a question for you with the global perspective.
Kendra, we have a question regarding the importance of fish, especially during COVID-19, as a nutritional powerhouse. Can you tell us a little bit more what has been said globally on fish and aquatic foods?
Sure. I mean, fish and aquatic foods are a nutritional powerhouse. They're very nutrient rich among the food groups. They're second only to vegetables. And there has been a bit of focus on omega-3s and their role in the immune response to COVID-19. But given that fish are just part of one piece of a healthy diet, so it's important to consume a variety of healthy foods, of which fish are just one, and fish are a very good source of a number of nutrients needed for the immune system. But it's important that it's in the context of a broader, healthier diet. And so Marion talked about potentially how diets are going to change as a result of the COVID-19 pandemic. And I alluded to a little bit in my presentation, but there are obviously going to be changes, and hopefully as supply chains get disrupted, and especially the supply chains of perishable foods such as fish, hopefully we don't see an increase in packaged foods and foods with a lot of preservatives, fat, and salt, which can survive a supply chain, a disrupted supply chain. So we really have to come forward as researchers working on supply chain and working on nutrition and working on dietary quality to make sure that these nutrient-rich foods, such as fish and such as aquatic foods, are available and in demand and being consumed by people, not only to prevent new infections, but for people who are fighting infections.
And now I have one question. Thank you, Kendra. Now I have one question which I'd like to pose to Marian. Marian, are you there?
Yes, I am.
So from Denmark, where there have been few COVID deaths, the average age of those dying from COVID-19 is 82 years of age. So I wanted to know, and we know that in North Europe, Norway and surrounding countries, that we have quite a large elderly population. Can you tell us anything about what special measures have been taken with respect to the elderly and nutrition in this time of COVID in Norway?
I have not seen any discussion regarding nutrition for this age group, so it has been more like they have been isolated, not being allowed to have visits by their families, and also when those that became sick had to be alone when even when dying. So it has been more focus on this part. I think so in general there has been little focus on nutrition, so it has been more access to food in general, and when it comes to food, more the hygiene aspect on concern about how the virus could it be transmitted or not. So what I hope is that maybe there will be a new discussion about school feeding programs. Oh. So because that has been discussed over and over again, and because maybe it also could help to make social differences a bit less, which has been increasing in Norway recently, and where food is in the national service, you can say quite good correlation between income and healthy diet. And if those results we have as yet show that staying away from school also among those with lower income increase the nutrient intake or a better nutrition, I think we should aim in finding some solution to make the nutrition in school and kindergarten better for all.
Marian, and thank you for bringing up that about school feeding programs. There are many global initiatives also from FAO, from World Food Program, and from the GAIN, and they all have recommended as one of the first responses that should be put in place with respect to COVID-19 is to strengthen school feeding programs. And we've seen also in America, from the surveys that they have done in America, the importance of school feeding program now in this period where schools are closed. Yes. Now, Donna has a question to Shaima.
Hi, Shaima. We received a question regarding the first 1,000 days of life of small children, and how are these groups being cared for during the COVID-19 crisis, especially young mothers and their children under 2 years old.
Thank you, Donna. So actually our nutrition program is to help the vulnerable groups in here. So vulnerable groups means actually under 2 children and pregnant and lactating women, and we are actually working for them. So we in Bangladesh with some partners we are working with nutrition workers, that they are the some volunteers. They are actually demonstrate the household about the how to prepare food for to support the mothers, to support their child. So it is it is on, so then that the workers are actually we are selecting them from the community. They are the community people, and those who have acceptance, we are selecting those peoples. So still it is COVID-19 is going on, and we have lockdown is carrying on, but they are the workers, they are trained and they are staying at that community. So we so it is like that. We for BRAC we are working with them, that team. For TMSS we have this workforce. So we so in case of any difficulties that our community health workers are over there, so to help that community people. And you know that in some programs we have some products, fish-based products to support 1,000 days. So we have fish powder for mothers, we have pickles, so we have experience over there. So we have planned to in future to work on that, but recently all of our nutrition activity is focusing the importance of dietary diversity of pregnant lactating women, the dietary diversity of under 2 children, and we are working on that. So in this way we are actually focusing, and we have we have our materials on that, we have our strength on that. So and so and for me, and I work for 7 years. I have experience to work on 1,000 days of to Windows opportunity. So I'm trying to implement that my knowledge in through my program also. So in this way, actually, we are trying to help our community. So it is already during this lockdown also that our community peoples are getting call, that our workforce are getting call to how to solve this problem. And another thing I already mentioned in my presentation, that we are using our workforce, we are using our local TV channels, we are using national TV channels, and we are also providing direct messages to our farmers group, so they can aware of that nutrition of their family, they can maintain the nutrition of their proper nutrition level of their child or the family members. Thank you, Donna.
Thank you, Shaima. We have another question coming from Marianne. And the question is, you mentioned that there is an increase of consumption of local fish now that COVID-19 situation has impacted global food supply chains. How can we build on that, and how can we make fish a bigger part of the diets, the global diets?
That's a really good question and difficult answer, but I think I saw some reports as well that the fish was not regarded critical for food as food in some places around the world, and I think continue working with what I think you have already started with focusing on fish as micronutrient source. I think that's not only as protein source. I think that's maybe one way to make it more visible in the discourse internationally, and also that we need more data on this. So everybody says that fish is healthy, but we have a lot of knowledge gaps when it comes to both the nutritional data, how nutrition may be changed through the value chain when you process, when you store the fish, when you prepare it, how that will affect the different nutrients, and also when it comes to consumption data. So I think we need more scientific data on how fish and fish consumption and how much you need to eat to get the benefits for increasing bioavailability from cereals and vegetable sources when it comes to, for instance, iron and zinc. So if we can generate more knowledge, it will be more difficult to not include fish in all discussions and all intervention programs aiming to better the nutrition.
Thank you, Marianne. Kendra, I have another question for you, and maybe I'm putting you in the spot, but let's see. I know you work a lot in Nigeria, and now with the with this COVID-19 situation in Nigeria, how are you all dealing with this with response to the work you are doing in the fish sector? And have you seen responses being put in place?
Okay. Yes, thank you. I wanted to talk about Nigeria in my spiel, but I only had 6 minutes. So thank you for that question. Yes, so it is concerning that in the poorer households in Nigeria that we surveyed, the most commonly purchased fish was mackerel, which is an imported fish, which of course supply chains being disrupted. That means that a major source of fish in people's diets is potentially not as available. So that's something that needs to be addressed. I'm talking with the team to maybe gather some more information or to figure out if we can do some follow-ups to find out more information on the availability of fish in the diets of Nigerians. And in addition, our technical report that we're submitting takes into account the COVID-19 situation, and we're putting together a response for the food system in Nigeria in regard to COVID-19.
Thank you so much, Kendra. I would have continued with Pamela, but since we can't get her on, I would go back to Shaima. Shaima, so in Bangladesh, there have been lots of first with the COVID-19. One of the largest problems that has been happened is and with the lockdown, with the transportation sector and with the movements of perishable foods like fish, and also for having the fish production systems come back in place now with having fingerlings in ponds and getting fish feed, getting fertilizers. Can you tell us what responses the governments have put in place to get these parts of the agriculture to work again?
Thank you, Shakuntala. So actually, government's taking some initiative that recently they declared for around $11 billion, $11 million of soft loan for agriculture and garment sector. So to actually stimulate this sector, and this you know that. The density of population of Bangladesh is very high. If you consider all over the Bangladesh, it is around more than 1,000 people lives in a square kilometer. In case of Dhaka, more than 23,000 people are living here. So actually, all supplies are used to come here in Dhaka city. So due to lockdown, and you know that a huge vacation, people actually you are not leaving actually leave Dhaka. They are staying at home, and due to Eid vacation also they are not staying at Dhaka. But now people here is moving here, and how it would be possible, because you know that they are depending on the daily wages. So people are now moving around. They are not strictly maintaining this lockdown, and you will get crowded in everywhere. People are crowded in everywhere. So this process is actually not so extreme nowadays because of the food they are going out. So and government also taking initiative that I told you that that fish transportation, they are not maintaining, they are not set any restriction for that, so that it can move. But the problem was they are not sending this fish in Dhaka because people are not in here. There are actually prices of 1/3, and at the same time that demand is not so high. So that it is a very difficult for the fish producers. They are not harvesting this fish, and they are maintaining it is actually affecting some extra efforts to them. And but as it is now, it is a little bit people is not maintaining it is strictly this this lockdown, and hopefully from after this 30 of this month, this lockdown will be not continue, and everything will be get normal. Then I think we will able to continue our regular activity and liberal lifestyle after that. So that's the thing.
Thank you, Shaima. And now Dunya has a question for Marian.
Hi, Marian. We have a question from the attendees. How much has the per capita of fish versus shellfish consumption increased in Norway during COVID-19? If you have that information.
Sorry, I don't have that information.
Okay, so we have another question.
Questions that has been asked by one of the attendants is the role of dried fish in countries like in African countries, and also Shaima, perhaps you can give a comment from Bangladesh. But first you, Marian, because of your work in Africa. Let's hear from you.
Yeah, I don't have any knowledge about changes that may have been implemented or due to the crisis, but I think that dried fish is really something that could, we already know that you can store it for quite a long while, and also that it keeps at least some of the nutrient or the quality when it comes to nutrients. So I think dried fish could really have a potential to help people having access to nutritious food during crisis, also in the future. And in our project, Small Fish Food, this is one of the aims of the project to find solutions for better quality of dried fish, and also make systems to make drying more efficient and still being possible to use for everyone without having owning land and so on. So I think dried fish, that's really something that we should work more on.
Thank you, Marian. And Shaima, may I ask you, have there been any efforts in Bangladesh making use of dried fish, also with respect to coastal vulnerable populations and refugees?
Yeah, so yeah, Shakuntala. So yeah, it is a big sector still we have to work on, because we have to concentrate on that, because we know that we cannot introduce perishable raw fish because of its perishability. Because if we can ensure any dry fish that is 100% safe, we can actually easily include in different programs. In Bangladesh, you know that it is fish is the third most commonly consumed food, and it is the first animal source of protein in case of last 10 years it actually give a huge peak in case of consumption, and people like to eat fish. So we have good acceptance of that. Because another thing that recently we did a study, and in this study we asked the people that what can be the fish-based product. So the only one product they mentioned, that is the dried fish. So we have the acceptance of dried fish, and in case of raw fish, we like to cook. We like to have cooked fish, fresh fish. So we have lots of opportunity to in this sector. I think it is our limitation if we because we are the WorldFish person. So we didn't ensure to any safe dried fish and in an affordable price, because we have huge fish. Yeah, so I think we should concentrate in future in this sector, because we have the acceptance, we have the fish, but for that emergency situation, we have to support the community people.
Thank you, Shaima. I have one comment from Don Griffiths, who works in Myanmar, works with WorldFish in Myanmar, and I'd like to pass this on to all our attendees. So Don is saying that in Myanmar, the government and other stakeholders are extremely interested in what's happening with food consumption during this time of COVID-19. And many are asking that surveys be done so that food intakes are being recorded. And I just want to make sure to all our listeners that please, if you are doing this in your respective countries, in your respective projects, please do ensure that you include fish and other aquatic animals and other nutritious foods within your service, and look at a variety of nutritious foods, a variety and diverse variety of nutritious foods, and not just the staple foods as many do when they do quick food surveys. With that comment, I would like to thank everyone for taking part in our Fish Talk. I do hope who have attended, and thank you for attending, have got something out of it. And we look forward to meeting you again in a couple of weeks with a new program. Thank you.
We will publish this recording as well and share it with all of you.
Yes.
On our social media channels. And as Shakuntala said, this was a good event for all of you.
Thank you.